This is Dr. Steve with Rockwall CPR, and today we're going to talk EpiPens, or what's properly termed an epinephrine auto-injector. EpiPen is a brand. You can see we are on the EpiPen.com website, and this is a really important page, the Frequently Asked Questions page. You can access a lot of material, and the first thing I'd like to point out is a step-by-step use guide video, which you should definitely watch. Since this is copyrighted, I'm not going to show it now, but you can click on that and watch how to use an EpiPen. And then it's going to go over a couple of things, so let's take some time and do a small deep dive on anaphylaxis, and let's open up these links. What is anaphylaxis? It's a potentially life-threatening allergic reaction that can occur quickly, like really quickly, in a couple of minutes of exposure to an allergen. What might that be? It could be a food. It could be an insect bite. It could be medication. It could be latex. What are the symptoms? This is really important because if somebody has anaphylaxis types of reactions, we need to know is parents, as providers, as sports coaches, as youth group leaders, etc., how might that look for that person? So this says the symptoms can vary. It involves the skin, so it can cause hives, itching, redness. That's very common. Swelling of the lips and tightness of the airways. So when you have that stridor, that type of breathing, it is very real, and again, it can occur very quickly. It can also show up as gastrointestinal, so nausea, stomach pain, vomiting, diarrhea. It can show up as a fast heartbeat, chest pain, and it can show up in the central nervous system, meaning headache and confusion. So it's really important if you're in the care of other people, or if you care for other people, what does it look like for that person? What are the things that put people at risk? Well, it's exposure to these allergens. Also, age can be a factor. Medications and different chemicals, disorders such as asthma. So you really want to know a little bit about a health history for disposing factors. Now, this is a good question. I've had a life-threatening allergic reaction. Can I have another one, or do I build up a tolerance? Well, if you've had anaphylaxis, likely you'll be at higher risk for another reaction. But it's really not possible to predict when and if you'll have another episode. So it is possible to become less sensitive, but that usually happens after treatment like allergy shots, as this says. What foods typically cause anaphylaxis? Well, about 2.5% of Americans have some type of food allergy, and it could be peanuts, tree nuts like walnuts, pecans, shellfish, other types of fish, milk, cow's milk, eggs, wheat, soy account for the majority of these reactions. So that's the first part of EpiPens and the frequently asked questions, and we'll make a few videos so as to keep these a little bit shorter. Learn about your EpiPen if you need one, and if you're in the care of others, if you care for others, you must learn about EpiPens. This is Dr. Steve with rockwallcpr.com.